Now we proceed with the official inaugural ceremony of RHEUMACON 2025. And I request on stage Dr. Gayatri S. to kindly take over the proceedings of the inaugural ceremony.
Good morning, one and all. We shall proceed with the inauguration of the ceremony. At the outset, I'd like to invite the following dignitaries onto the dais. Professor Sajit Kumar, Principal, Government Medical College, Kozhikode. Dr. N.V. Jayachandran, President, IRA Kerala Chapter. Dr. Vishad Vishwanath, Secretary, IRA Kerala Chapter. Dr. Vinod Ravindran, National President-elect, IRA. Dr. Binoy Jaipal and Dr. Ramesh Basi, Patrons, IRA Kerala Chapter. Dr. Sukesh, Organizing Secretary, RHEUMACON 2025. And Dr. Adarsh, Scientific Chair, RHEUMACON 2025. Thank you. Now I invite Dr. Adarsh to give the welcome address.
A very good morning to all. On behalf of Indian Rheumatology Association Kerala Chapter, it's my privilege to warmly welcome you all to RHEUMACON Calicut 2025. We are deeply honored to have with us our chief guest, Professor Sajit Kumar, Principal, Government Medical College, Calicut. Sir, your presence and constant support for academic growth truly inspires us, and we extend our heartfelt welcome to you. It's also my pleasure to welcome the leadership of Indian Rheumatology Association. A warm welcome to Dr. Jayachandran NV, President, IRA Kerala Chapter, whose guidance continues to elevate rheumatology across the state. I also extend a special welcome to Dr. Vishad Vishwanath, Secretary, IRA Kerala Chapter, whose dynamic efforts strengthen our professional community. A heartfelt welcome to Dr. Vinod Ravindran, National President-elect IRA, and he is the first person in Kerala IRA to honor that position. Sir, we look forward to your vision for the association in the coming years. We are privileged to be guided and encouraged by our esteemed patrons. I welcome Dr. Binoy Jaipal and Dr. Ramesh Basi, whose unwavering support has been instrumental in shaping this event. A very special word of appreciation and welcome to Dr. Sukesh, the Organizing Secretary, whose commitment and meticulous planning have transformed the idea of RHEUMACON into a reality. To all faculty members, delegates, students and guests who have joined us from near and far, welcome to Calicut, and thank you for being part of this academic celebration. With great joy and pride, I welcome you all once again to RHEUMACON Calicut 2025. Let us look forward for enriching discussions, meaningful collaborations, and a memorable learning experience. Thank you. And now I invite Jayachandran sir to start with the proceedings.
Very good morning to all. Our chief guest of the day, respected Principal of Calicut Medical College, Professor Sajit Kumar sir. Other dignitaries on the dais, senior teachers, senior members, distinguished delegates, friends and dear students. It is with a great pride and a deep sensation of feeling of responsibility that I welcome you all to this annual conference of Indian Rheumatology Association. Today's meeting is not just another meeting, it is a celebration of our collective commitment to improve the quality of lives of rheumatic patients with rheumatic disease across Kerala. And first of all, I would like to thank our principal, Dr. Sajith Kumar, sir, for kindly accepting our invitation to inaugurate this meeting in spite of his busy schedule. I also thank Dr. Alakendu Ghosh, sir, who has come from Calcutta on our invitation. We will be honoring him in the meeting immediately after this function. And I also thank Dr. Sukesh, Dr. Adarsh, and the team Calicut, who have been working hard to make this function a grand one. Rheumatology, as we all know, is one of the fastest growing specialty of medicine. In the last 2 decades, we have seen tremendous improvement in the understanding about rheumatic diseases and the better understanding about the pathogenesis of disease and newer treatment modalities have made the outcome of rheumatic disease patients in a very positive manner. And right now we are able to offer our patients a very good quality of life that was unimaginable in earlier years. And Indian Rheumatology Association believe that information on scientific progress must be shared and translated into better patient care. And for this, we have been conducting CME programs across the state at regular intervals. And these meetings have been very useful to postgraduate students and physicians. And it helped to strengthen clinical skills, enhance early diagnosis, and empower physicians to treat rheumatic diseases with greater confidence. This year, our association, we have taken another important step. We have decided to initiate research programs involving our members. Rheumatologic diseases in India have unique patterns, challenges, and patient profiles. And it is essential that Kerala contributes to global understanding of the disease through high-quality clinical research. That is what we are lacking. And I am confident that our members will rise to this opportunity and generate meaningful data that will guide future practice. As an association, we are deeply committed to improving both treatment and teaching facilities in rheumatology in our state. Kerala deserves more trained rheumatologists, greater access to advanced therapies, and we need to strengthen our postgraduate education in this field. Rheumatology has become one of the most sought after super specialty courses in the country, and we need to start DM courses in our medical colleges also. I am sure our principal will be able to help us in this regard a lot with his influence. There is gross lack of awareness about rheumatic diseases among people as well as doctors. Too many patients still suffer due to delayed diagnosis or misconceptions about arthritis and autoimmune diseases. Through scientific programs and public education, we need to change this scenario. Today's conference is a reflection of all these aspirations. It brings together rheumatologists, physicians, and postgraduate students, each contributing to the vibrant academic culture of our specialty. I sincerely thank the organizing team for their dedicated work and all the speakers and delegates for being part of this scientific journey. Thank you all for your presence, your support, and your dedication to the cause of rheumatology. I wish the conference great academic success and meaningful discussions. Thank you.
We shall now proceed to lighting the lamp.
I request Professor Sajith Kumar sir to light the lamp and then address the meeting.
I invite the chief guest to address the gathering.
Very good morning to all. Respected President, IRA, Kerala State, Dr. Jayachandran NV, Dr. Vishwanath, Secretary, Dr. Vinod Ravindran, President-elect, National IRA, Binoy Sir, Dr. Ramesh Basi, Dr. Adarsh, senior members, delegates, and dear friends. First of all, let me thank the organizers, Dr. Jayachandran, Dr. Adarsh and team, the whole rheumatology team, for inviting me for this conference. As you all know, nowadays the disease spectrum had already changed. That's when we were students 30 years back. The clinical scenario and disease spectrum, now it is in the changing process that everybody knows, like lifestyle diseases, malignancy, and rheumatological diseases. And this conference, the organizers are included the various commonest rheumatological problem. And our postgraduates and young clinicians, they will get a chance to interact with eminent faculties in the field of rheumatology, and they can update their knowledge, and they should be familiar with the emerging trends, the evaluation, and the management, so that our patient will get the treatment in the real time, so that they will get cure, or what you say is remission, or we can minimize the disability. And now it is more organ specific, so we should have cross consultation, as the Dr. Padmanabh Shenoy had his discussion regarding the pulmonary hypertension. Whenever cross consultation we have to do it, because everybody is now afraid of litigation, but you can treat. And this conference, I believe, will be beneficial for all the postgraduates and young physicians, the clinicians, those who are attending this program. As Dr. Jayachandran already mentioned regarding the DM in rheumatology course, we are, this year we had started DM nuclear medicine in Calicut Medical College, first time in Kerala State, and also BSc nuclear medicine. And we are about to get the MCH surgical gastro this year, coming year. And now we are on the process of getting the DM rheumatology as well as DM oncology. The paperwork is ongoing. We hope we will get it in the next year or near future. And with all your permission, I officially inaugurate this CME program, RHEUMACON 2025, and I wish all the very best for this program. Thank you once again for inviting me. Thank you very much.
Thank you, sir. A kind note to those at the back, since we have a session in progression, kindly continue having tea in silence, because we are officially not on a tea break. It would be of immense help if silence is maintained during the session. Thank you. I request Dr. Vishad to proceed with the secretary address.
Respected Principal Dr. Shajid sir, respected members on the dais, and respected Alakendra sir and other dignitaries who have assembled here. Rheumatology in the last 3-4 decades has seen rapid strides in development. It has been spurred by the developments in the field of immunology and genetics, and the science has translated in a very fascinating fashion. And this has also translated into better patient care. And true to reflecting this improvement in the specialty, the interest in the specialty has also continuously increased. From a time where we used to have a handful of rheumatologists serving across the state, now we have rheumatologists in almost all the major places in Kerala. And right now, I'm proud to say that rheumatology is one of the most sought after super specialization in the national eligibility tests. Rheumatology in Kerala has made rapid strides in development, and this has been because the practicing rheumatologists that we have, they have been people who have been rooted in science and have expressed their patient care with compassion. And this meeting reflects these values of science and compassion. It started off with a patient education program on Friday. We had a rheumatologist-oriented meeting yesterday, and we have a meeting that is addressing the venting the thirst of rheumatologists as well as aspiring rheumatologists today. So basically, and I should say that this is a very wonderfully crafted program. And we had an excellent GB yesterday. We discussed the future plans for development of rheumatology in our state. And we are also highly enthused by the fact that Dr. Vinod sir has been elected as the president-elect for IRA National, IRA, and we expect a lot of contribution, a lot of development in this field associating with him in the near future. I should especially thank Sukesh and others for putting up such a great show and scientifically well-placed, excellent hospitality, and excellent science. Thank you. Thank you all.
Thank you, sir. I request Dr. Sukesh to deliver the vote of thanks.
A very good morning to all. On behalf of the organizing committee RHEUMACON 2025 Calicut, it's my privilege to deliver the vote of thanks. First and foremost, I expressed our deepest gratitude to our chief guest, Professor Dr. Sajid Kumar, Principal Government Medical College Calicut, for gracing this occasion with his presence amid his busy schedule. Our heartfelt thanks to the leadership of Indian Rheumatology Association. We are grateful to Dr. Jayachandran NV, President, IRA Kerala Chapter, for his guidance and encouragement. A sincere thanks to Dr. Vishad, Secretary, IRA Kerala Chapter, for his dynamic leadership and support. And we also extend our warm appreciation to Dr. Vinod Ravindran, President-elect IRA, for being with us today. And we are honored by the presence and blessings of our patrons, Dr. Binoy Jaipol and Dr. Ramesh Basi. Thank you, sirs, for your unwavering support and for standing with us throughout this journey. And I would also like to thank Dr. Adarsh, Dr. Anup, Dr. Chandu, and Dr. Gayatri for their active involvement, teamwork, and commitment that kept every aspect running smoothly. Our sincere appreciation goes to our event management partners, Team Creative, for their professionalism, seamless coordination, and attention to detail. We also thank Kadau Resort for providing a beautiful venue, excellent hospitality, and all the support needed to make this conference comfortable and enjoyable for everyone. To all faculty members, delegates, students, speakers, and participants who have joined us from various parts of the country, thank you for your presence and for enriching this event with your contributions. Finally, a warm thank you to every member of the organizing team, the technical staff, volunteers, and everyone working behind the scenes. Your hard work is the backbone of this program. With gratitude, I thank each one of you for making RHEUMACON Calicut 2025 a grand success. Thank you and have a wonderful day ahead.
Now, that's why we are concluding the official inaugural ceremony. We once again thanking all our dignitaries, and we request everyone to kindly take a seat back. And we request all our delegates to kindly maintain silence while having refreshments inside the hall as we have ongoing the sessions. Moving forward, we have Professor Joy Philip oration. May I now request our chairpersons to kindly come forward and take charge. Yeah, before we move on to the oration, now we'll now break for the 10 minutes tea break. So please be seated back in the hall in time for the next session. Thank you.
We request all the delegates to be seated. We will start the next session. Thank you.
We request all our delegates and dignitaries to kindly take a seat back. As we are running short on time, once again we request everyone to kindly take a seat back. May I now request our chairpersons for the Professor Joy Philip oration, Dr. Jayachandran NV, Professor of Medicine, GMC Kozhikode and President, IRA Kerala Chapter, Dr. Vishad Vishwanath, Consultant Rheumatologist, Iris Thiruvananthapuram and Secretary, IRA Kerala Chapter, to kindly take charge. May I now invite Dr. Vishad Vishwanath to initiate the proceedings of oration.
Once again, good morning all. It gives me great privilege to once again remind us all about the achievements of my teacher, Dr. Joy Philip sir, whose memory we are celebrating today. Joy Philip sir, as you all know, was a senior rheumatologist and former professor and head of medicine at Medical College Trivandrum, and one of the earliest members of Indian Rheumatology Association, and one of the earliest practitioners of rheumatologists in the country. As a student, sir had an extremely high academic track record, and he received out of the 13 gold medals that were in offer, he received almost all the 12 out of the 13 gold medals that was offered in MD medicine during MBBS. Sorry. After MD, he joined Trivandrum Medical College as a faculty. He had a keen interest in rheumatology, which was at its infantile stage in India at that time. In 1982, he followed his passion and he applied and received the WHO fellowship to be trained in rheumatology in UK. After the training in rheumatology from UK, he joined the Department of Medicine and started a rheumatology clinic for the first time in Kerala back in 1983. He was a very popular physician and a rheumatologist with a very good clinical sense. As a medical teacher, he was beyond comparison. Two unique qualities of sir was humility and humor. He was a great orator who could convey scientific messages in a very simple and humorous way without diluting the content. His undergraduate and postgraduate classes were highly sought after, and he proved to his students that learning is always fun. He was the secretary of IRA Kerala chapter and IRA national chapter, national IRA as well, and he held the post of vice president of national IRA for 3 terms. He was also the founder secretary of Kerala chapter of IRA and later became the president, and he was the patron of IRA state chapter till his demise. He conducted the National IRA Conference in 1996, in Trivandrum, the Tricon 96. He conducted it almost single-handedly. He has received several awards and accolades in his illustrious career. He was bestowed the prestigious Eminent Passe Award by the IRA for his outstanding leadership and distinguished contribution to the field of Indian rheumatology. He was a complete teacher, providing knowledge, imparting clinical skills, and acted as a role model for generations of his students, and he continues to inspire us. He was very friendly to his colleagues, popular among them, subordinate staff, and patients. He left a permanent imprint on the heart of anyone who came in touch with him and provided positive energy to people around him. By his own life, he proved his own words. It is the attitude, not the aptitude, that determines one's altitude. Sir left for heavenly abode in 28 May 2022, and Kerala chapter of IRA is conducting this oration in his honor. Now may I invite Jayathan sir to take forward the proceedings.
Friends, we are going to have one of the most important program of the day. I request Professor Alakendu Ghosh sir to please come over to the stage and be seated. As already Dr. Vishad said, Indian Rheumatology Association Kerala chapter every year conducts this Dr. Joy Philip Memorial Oration in fond memory of our late Dr. Joy Philip, who was a legendary figure in rheumatology as well as medicine. And every year we select legendary figures of rheumatology in the country. And last 2 years we have given this award to Professor Rohini Handa and Professor Narasimlu. And this year we have invited Professor Alakendu Ghosh sir. Indian Rheumatology Association Kerala chapter proudly honors Dr. Alakendu Ghosh, a visionary leader, educator and pioneer in rheumatology and clinical immunology. He is a distinguished senior consultant in rheumatology and clinical immunology with over 30 years of teaching experience. As the founder professor of West Bengal's first accredited rheumatology department, Dr. Ghosh has mentored countless trainees and championed accessible healthcare. Internationally recognized, Dr. Ghosh served as past president of the Indian Rheumatology Association during 2020 to 2022, and he received the Asia Pacific League Against Rheumatism Master Award in 2024 and was honored with the Honorary Fellowship of the Royal College of Physicians, London in 2015. He has led over 12 major research projects, coordinated undergraduate rheumatology programs, and organized national congresses. Renowned for his orations and research presentations, including at the American College of Rheumatology, Dr. Ghosh's career exemplifies dedication to clinical excellence, research, and mentorship, shaping the future of rheumatology in India and beyond. Ladies and gentlemen, we, Indian Rheumatology Association Kerala chapter, is proud and happy to honor Professor Ghosh in memory of Dr. Joy Philip sir. Now I request sir to come.
Well, good morning, everybody. I'm really honored, humbled to be invited on this great occasion in the name of Professor Joy Philip. And Professor Joy Philip, as Bishad was telling Vishwanathan, that is aptly named Joy because whenever we met with each other, an environment becomes really joyful. And every time with all its interaction, all its messages, full of science and humor, and the best quality of a teacher, as is always mentioned, that to create interest, to identify the fun of clinical medicine, Dr. Joy Philip used to have this culture and inculcated. In several years back, when I visited for some other purpose in Trivandrum, I met with him. He told that come to my department and interact with the postgraduate students. And I had the privilege of spending time with the postgraduate students in Trivandrum Medical College several years back, at least 2 hours, with some clinical issues and like that. And it was an amazing experience, I must share. And I took up lupus looking beyond, because all of us have the experience of treating patients, rheumatoid, lupus, scleroderma, like that one. But until unless we go beyond the boxes, common standard concept of discussing with the patient, treating the patient and forgetting about them, so we cannot have a real spectrum of patients' management holistically. So I have planned to talk on the lupus pathogenesis, what's happening for 2024 or 25 precisely, and the outcome measures and the heterogeneity of the outcome measures and what's the current scenario of outcome measures, emerging therapies beyond the standard, and the talk of the day precision medicine and patient-reported outcome as we are practicing, we have shared in the international arena from the database of our lupus initiative, Kolkata 600 patients cohort. So if you look to the pathogenesis, we all appreciate that it's an interplay between innate and adaptive immunities. It's an interplay between the innate immunity and adaptive immunity, and through this T helper cells and B cells, and the Treg and Th17 cells are the key players, and finally interferon signaling is a key cytokine. And this has been beautifully illustrated in one of the recent literature published, and which has given a new vision of pathogenesis, that innate lymphoid cell through MHC targeting CD4 T cells, creating interleukin milieux differently, and through this different interleukin milieu, the cytokines are being directed to create the pathogenic spectrum, like IL-12 dominating intermilieu, giving rise to interferon gamma cellular immunity, whereas on the other hand, IL-23 through STAT3 through Th17 giving rise to autoimmune diseases, and in between we have IL-4 milieu and IL-2 milieux. And ultimately, the summary is there is overactive immune responses, skewed cytokine microenvironment, and impaired debris clearance machinery. And keeping these concepts, the ongoing research activities of IPJMER Kolkata is first detection and characterization of cell-free DNA in plasma for patients with SLE, and this was funded by Indian Rheumatology Association. And we tried to identify the quantification of cell-free DNA, OGGI, DNase 1, and oxidative DNase. And there is enhanced cell-free DNA in lupus nephritis plasma been documented, and the positive correlation with SLE disease activity index indicated their possible role towards disease progression. So what is the source of cell-free DNA, and what is the impact of oxidative stress? And does enhanced cell-free DNA have any impact on redox status are being cultivated in our lab? Second component of research activities which are being done is metabolic bioenergetics of CD4 plus T cells in patients with SLE, effect of metformin, and this is funded by Department of Science Technology. And this is the background of the study, CD4 T cells in lupus through AKT activation, PI3K, mTOR, giving rise to reactive oxygen species, and this reactive oxygen species produces neoantigen and DNA extrusion leading to etosis. What metformin does, establish mechanism through AMPK increment and decrement of mTOR causes decreased ROS production and netosis or DNA release. And these can metformin regulate metabolic reprogramming induced oxidative stress in CD4 plastic cells are being experimented in our lab, and the future, that is, as we all appreciate, that through these activated CD4 plus T cells, there is mitochondrial dysfunction leading to ROS-induced DNA extrusion from lymphocytes with formation of neoantigen and positive feedback loop and reactivation of antigen presenting cell, and this feedback loop being continued. And this has been presented in the last EULAR conference 2024. And the next components of important laboratory experiments which are being continued in IPGML lab is the immunoprofiling and gene expression of EZH2 in patients with proliferative lupus nephritis towards personalized treatment, and this is also funded by DST. And the current therapeutic regimen in lupus nephritis, all of us knows, there is induction followed by maintenance, and now last recommendation has mixed this induction and maintenance, and they have clearly differentiated class 3, 4, 5. Triple drug therapy should be initiated, should be continued. And the relevance of this study is that what is EZH2, this is a component of PRC2 present in nucleus. There is recruitment of SAM, repression of tumor suppression gene, and decrement of apoptosis. And this EZH2 has got a good correlation analysis of the association between clinical parameter and soluble EZH2 level, and correlation analysis documented that EZH2 promotes B cell dysregulation and hyperproliferation of plasma cell that leads to autoantibody production and lupus nephritis pathophysiology. And this EZH2 inhibition has been identified to document the upgradation of the lupus nephritis, refractory lupus nephritis population treatment. And this got the second prize in basic science in RHEUMACON this year. Next comes the outcome measures. We have a lot of outcome measures, but there were limitations, and the novel outcome measures are being identified, and towards a novel clinical outcome assessment for systemic lupus erythematosus, first outcomes of an international task force. Why the new outcomes are being required? Because the outcome measures which we are using, DORIS, SRI-4, so all these have got a minimal reflection of minimal changes of improvement or deterioration, and the individual major organs cannot be compiled. So, and lack of patient input is there in determining which concepts are important to be measured. Use of discrete thresholds introducing floor and ceiling effects, limiting the ability to capture variations in the severity of manifestations. Numerical thresholds defining improvement and fixed weighting applied to manifestations that are not based on empirical evidence of meaningful within patient change, developed using post hoc analysis of trial data, risking bias to specific drug mechanism or specific study design. Some included manifestations are poorly defined or are rarely appear in clinical trial. Adoption in clinical trials prior to extensive testing of measurement property can be complex and non-intuitive to complete and interpret. So this concept of treatment response measures in SLE, it's not yet finalized. In step 1, step 2 already been elaborated. And this involves the A domain, that arthritis is there, skin rash is there, serositis is there, autoimmune hemolytic anemia is there, thrombocytopenia there, nephritis is there, and joint pain there. And involvement of the patient group, representative pharma industry, policy makers and clinician. So all these groups, the stakeholders sitting together trying to identify, and they have defined through this A domain level of congruity, and they come up with multi-domain clinical outcome measurement, and the TRM SLE response scoring system are being identified. So this is one of the very new development. But we don't have to forget that it's not just a disease activity which is enough to measure. We have the sphere or platform of primary prevention to to identify smoking cessations to be done, vitamin D deficiency, hydroxychloroquine to be reinforced, or each and every patient from day one to be initiated to be continued lifelong hydroxychloroquine, asymptomatic APL positive individual low dose aspirin, and tight follow-up. These are for primary prevention. Secondary preventions like prevention of disease flare and primary strategies in addition to control of disease activity using appropriate therapy, non-life-threatening measures, life-threatening measures to be initiated in regular follow-up, tertiary prevention which involves the delay of disease progression and damage, primary and secondary strategies in addition to steroid sparing strategies, and we need to give enough importance to identify or assess the comorbidity impact, which includes cardiovascular comorbidities, premature atherosclerosis, as we all appreciate, and there is infection. That's a very important challenge in lupus patients, and each and every one has faced the clinical problem. Non-lupus patient presenting with fever, is it due to flare, would require increment of steroid, or is it due to infection, require decrement of steroid, addition of antifungal or antibiotics? And cancer, not to forget, and osteoporosis, again a very important challenge. Next, the emerging therapies, and these are the cartoon which involves all different pathways targeting lupus in the pathogenesis, but one should not forget that more than 25% of trials have been failed, and at the end of the day we were very happy with the traditional therapeutic intervention, but with the availability and FDA approval with 2 or 3 molecules, which are possibly would be the game changer in the planning of therapy. And these are T-cell, B-cell targeted therapies are there, T-cell targeted therapies are there, and antigen presenting cells are also being targeted, and we have got plasma cell targeted therapies are there. And not to forget, the cytokine directed therapies are also being identified. And these are some of the newer modalities of therapeutic intervention which has come up. There is a deep depletion of B cell with availability and approval of obinutuzumab, and that is a humanized to reduce immunogenicity, and there is improved direct cytotoxicity to B cell, and there is a fucosylated Fc region to improved Fc gamma R3 affinity. And we have CAR T-cell and BiTE cell therapy, which probably are giving up hope that SLE will be cured, quote unquote, in coming years. And there is reduced relapse of B cell numbers, and there is plasma cell targeted therapies are also sparing other B cell subsets as well. And cell-based and gene therapy, the new frontiers. CAR T-cell therapies in lupus have shown strong and promising results in refractory lupus, induce profound and sustained remission. Many patients achieve drug-free remission and low disease activity state, LLDAS, significant decline in SLE-DAI, SLEDAI-2K score, and remission rate around 70%. Ability of most patients to discontinue other immunosuppressive therapy. Adverse events are there also. Mild cytokine release syndrome, low neurotoxicity. There are multiple CAR-based therapies are coming up, and these are being first tracked by regulatory authorities for refractory SLE and lupus nephritis. What are the advantages? CAR-T target applies to a wide spectrum of B cell, including the antibody-producing plasmablast, are able to kill B cell not only in the blood, but also in the tissues. So these are the target cells, and we would like to achieve the remission, and this is the leukophoresis of T-cell enhancement, enrichment, and T-cells insert gene for CAR. CAR is chimeric antigen receptor CD19 recognition domain and signaling domain. And this CAR T-cell being expanded and reinfused into patient's plasma. And what are the achievements? There is CAR T-cells being, B cells are being gradually diminished, and CAR T cells are being identified in circulation, and there is decrement of autoantibodies, soluble component increase, proteinuria decreases, SLEDAI decreases. CD19 CAR T cells in lupus kill a B cell of autoimmune, which therefore eliminate dsDNA and other autoantibodies that cause damage in lupus. Normal appearing B cells emerge after a few months. They do not produce autoantibody. People do not lose immunity to vaccine because plasma cells are not targeted by CAR T cells. And people after CAR T are often able to stop all other lupus medication even for few years. This will be amazing in terms of therapeutic outcome of SLE patients in our arena. CAR T cells are able to kill B cells not only in the blood but also in the tissue. It is unclear at this time whether lupus can come back after several years, but it is possible. Who are eligible? Age more than 18 years, fulfilling the classification criteria, antibody positive, active disease with one organ damage or more than 2 bilag B, and insufficient response to traditional therapies. CAR NK cells, both CAR T cells and CAR NK cells offer transformative and potentially curative option for refractive or severe lupus patients. There is another concept has come up, BiTE cell therapy in lupus. Bispecific antibody which simultaneously bind CD3 on T cells and CD19-20 on B cells, thus directing T cells to selectively kill B cells, including tissue-resident autoreactive B cells that are difficult to deplete by traditional therapy. And this teclistamab has come up with good trial results. Early reports show successful use of teclistamab in refractory lupus, highlighting deep B cell depletion as a potential mechanism for rapid and effective disease control. And the pros and cons, BiTE cell versus CAR T cell. BiTE cell simultaneously bind CD3 on T cell and CD19-20 on B cell. Dual binding brings T cell into close contact with B cell, leading to targeted B cell killing without genetic modification of T cell. That is the advantage. CAR T cell therapy involves collecting patients' own T cell, genetically engineering them to express CAR specific for B cell antigen like CD19. While BiTE cells are standardized biologics readily available for infusion without customization, CAR T cell therapy requires weeks of manufacturing for patients' T cell with preparative chemotherapy before infusion, cytokine release syndrome more frequent and severe with CAR T cell therapy. So these are the advantages. What does the future look like? Different pathways dominate in different patients. Interferon gamma versus B cell plasma are dominant. One size fits all drugs will have limited impact unless paired with biomarker. There comes the concept of precision medicine. Safety and infection in reference to deep B cell depletion or immune depletion therapy, CAR T cell, artificial intelligence and digital tools for disease monitoring and management will become the new normal. We are moving from broad immunosuppression, like combining 3 drugs, 4 drugs randomly to each and individual patient with a stand-up stamp of class 3 nephritis, class 4 nephritis, to precision medicine, potentially curative strategies in lupus. So what's about precision medicine? Distinct gene dysregulation pattern herald precision medicine potentiality in SLE patients. And they have come up with interferon and B cell signature inform precision medicine in lupus nephritis. Interferon, conclusion is interferon upregulation and plasma cell gene dysregulation pattern reveal 3 lupus nephritis patient subgroup which may not necessarily represent distinct phenotype but rather phases of the inflammatory processes during a renal flare, providing a conceptual framework for precision medicine in lupus nephritis. And advances in precision medicine with biomarker and AI-driven diagnosis and treatment response prediction and targeted therapy has come up in discovery science with availability of biomarker for assessment of clinical disease activity in patients with lupus nephritis and evaluation of testament response and prognosis also. Next comes the most important part, which we feel is patient-reported outcome. We have our patients population in our Lupus Initiative Kolkata, which have initiated in 2008 with an objective to involve the patients also in the decision-making process, improvement in quality of life outcome in lupus from a patient support group in India, and over 600 patients are currently part of the LIK support group, completed responses within 6 months and after 3 years of joining the group from 22 patients after screening, utilized the Bengali language validated version of lupus quality of life questionnaire, as well as obtained data on medication adherence, percentage of correct immunosuppressives over the last 6 months and appointment adherence, percentage of months of follow-up appointment not missed with a clinician over the last 24 months. And 600, out of 600 patients, 21 patients final list of complete response, and this is the result. And domain assess, physical health, pain, planning, intimate relationship, burden to others, emotional health, body language, fatigue, medication adherence, and appointment adherence. And this is the changes in each quality of life domain, like 3 years physician health, 3 years pain, 3 years planning, 3 years intimate relation, and 3 years burden, 3 years emotional health, 3 years body image, 3 years fatigue. And the conclusion, it highlights the positive impact of structured peer group in autoimmune rheumatic disease like SLE, focusing on self-efficacy and improved disease outcome, statistically significant improvement in each lupus quality of life domain and adherence, except those related to intimate relationship and body image. We aim to integrate such support group into healthcare model in the future, especially for undeserved population. Further long-term studies are recommended to validate this perceived benefit. This has been interpreted, if we remember the Hippocratic Oath, I will remember that there is art to medicine as well as science, and that warmth, sympathy, and understanding may outweigh the surgeon's knife or chemist's drug. So these have been presented in this year's APLAR Congress in Fukuoka. Lastly, 2025 American College of Rheumatology guidelines for treatment of lupus has come up with a reinforcement that ideally steroid to be kept zero if possible, conditionally recommended a slow tapers towards zero. So what are the key takeaways? SLE remains a heterogeneous condition. One size cannot fit all. New outcome measures need to develop, which is evolving. Precision medicine can allow targeted therapies based on individual endotype. Emerging therapies for mass and immune reset are come up. CV risk, infection, steroid adverse effects need to be minimized. Never forget patient determinants beyond organ involvement. Out of the mountain of despair, one stone of hope. That was given by Martin Luther King. So, to conclude, I am indebted to my patients' population and Lupus Initiative Kolkata, with whom we have started our journey 2008, and all the faces were morose and unhappy and what will happen to us. And during this last near 15 years journey, we have identified the upliftment of emotion, upliftment of positiveness, if we continuously being in touch with them, in addition to the therapy, medical follow-up which we are giving. Thank you very much. I am extremely thankful to Kerala chapter, and I am indebted to my good old friend Dr. Binoy Paul, Dr. Vinod Ravindran, IRA President-elect, Shenoy, and Jayachandran, who is continuously in touch with me every time, every day. Sir, any problem? I am so thankful to all of you and all the office bearers. Special thanks also to Anup. I have heard that he is behind all these events, so I am extremely thankful to all of you. Thank you very much. And Vishad also is certainly always helpful to me as usual. Thank you very much.
Thank you, sir. Thank you for the excellent and thought-provoking oration. As it is an oration, there will be no question and answers. On behalf of Indian Rheumatology Association Kerala chapter, me and Vishad express our sincere thanks to you for coming over to Calicut and delivering this excellent oration. Thank you, sir.
Now we extend our sincere thanks to the respected chairpersons of the oration, Dr. Jayachandran Nanvi and Dr. Vishad Vishwanath.